everybody. Welcome back to SHARC Doc Talk. I am Doc T, sitting here with Dr. Deonson, who is playing games with his microphone now.
Yeah.
We had all the time to set up. Now we're playing games with the microphone.
I don't know anymore.
Okay. Apparently, I just learned my water bottle sits in front of the microphone. That means I'm talking into the water bottle, which is bizarre. But I get it. We've had a weird one already.
Yeah.
We're starting off. It's been a couple weeks and feel like we're out of practice already.
Just a little bit.
Yeah, we got to figure it out. Hopefully, it sounds good. And welcome back, everybody. Glad to have you back here.
Yep.
We're going to start off with our normal catch up, see where we've been, what we've been doing, what's going on. Mm-hmm. And then we have a fun topic that is near and dear to both of our hearts.
Yeah.
That I was unaware of because I'm old, that this was even a thing.
Yep.
And we were in a car ride back from the Chargers preseason treatment stuff. And I asked him, I said, what's the world talking about? And we'll get into that in a second. But I was kind of like, wow, I can't believe that's even a discussion.
Yeah.
But what do I know? I'm old. So
Internet's weird.
Yeah, it's undefeated in making fun of people, but definitely odd for topics.
Yep.
But we call that bro science, and if it wasn't for bro science and we'd have nothing to talk about, we'd be bored out of our minds. So thank God for it.
Yep.
I thought we were going to hit a punchline. I'm like, yeah. Thought it was appropriate, but I liked it. So
it's in now.
let's jump in with a check-in.
Yeah.
How's the knee? How's the body? Where you been? What's going on? What's new? Who do you know?
Knee's been good. Just training now again. Haven't played any basketball for at least the foreseeable future.
Just because of life or by choice?
A little bit of both.
Right,
I've been busy, and then also I train for powerlifting.
Oh, you're a professional doctor now, so you're all busy, huh?
Yeah. Yeah. Well, busy just because I also do stupid stuff on the side.
Yeah. You're allowed.
Yeah,
we're all allowed.
And also it's like, hey, like I haven't trained basketball in a little bit, but
Are you back to train normal?
yeah, just for the most part. We're fine there.
Right.
Sometimes I'll get some aches and pains after like a really heavy squat day.
Okay.
And I'll just keep an eye on it. But outside of that, I haven't had anything that really stops me.
Good.
Other than like, yeah, this just kicked my butt. I don't really know what to do
Nothing wrong
the
with
next
that.
day. So I intentionally have a rest day after squats just to make sure knees are fine. There's no problems.
Yeah, very
And
smart.
we kind of go from there. In terms of patients, I had the heart-to-heart with a patient that came in for a free discovery visit type of thing. And it was like an emergency discovery visit.
Sure.
She was playing basketball with an older group of boys, and she was already being scouted for like colleges and things like that. And she's only around like the age of like 14, 15, around that age.
So young.
Yeah, got a couple offers already. Well, like soft offers, verbal offers.
It's just so amazing how young this happens.
Yeah. Then she had a non-contact injury on the court.
I swear those are the worst
Yeah.
ones. How did it happen? Well,
I was driving and
turned and
fell.
jumped.
Yep.
Okay.
And, once I hear that, a bunch of the red flags kind of pop off in my
sure.
head and everything
Yeah.
like that. And the family is like a friend of mine as well. So I said, hey, just come in. Let's figure that one out. I did a quick examination, but, with injuries that are so fresh like that, sometimes it's not going to show any
It's
positive.
near impossible.
Yeah.
Swelling involved, things like that.
Yeah.
You can't.
You're not
It's
going to
really
show
hard.
any like true positives or true negatives. Sometimes everything's going to hurt. Sometimes nothing's going to hurt. Sometimes it's not going to move because of the swelling in the joint. So I found a couple things, and I said, hey, the big bad of the ACL, I want to say that potentially you did it, but I also can't prove it with just the test because the knee or the hamstring isn't just letting me do the job of like a Lockman's exam. Lockman's exam is basically just to pull the knee, kind of see if it stops or not stop, or if there's any more give.
Just checking the ligament, see if it's attached or not.
Yeah, that's the biggest one, right? See if it's there. But sometimes you get a false negative or a false positive based on where they're at in the injury.
This is called babbling.
Yep.
Yes. Land your plane.
Yeah.
What do we do next?
I couldn't find a conclusive answer to it, so I said, hey, let's get the image, and then they were able to get the image that day, which was cool.
Oh, nice. That's rare.
And they texted me the next morning like, hey, complete tear of the ACL. And as a person that has torn my ACL, funny enough, everything like it was exactly the same. So I showed him my report too. I'm like, hey, weird twins. But I said, hey, it's okay to feel all the emotions right now because everything that just happened.
It's a hard one.
Don't suppress them, feel them, but just remember, like, hey, we're going to get back out of this. So right now we're kind of developing a plan of attack. I wanted to give them like a little bit of a week before we start making any decisions. And kind of.
Are they reattaching it?
Most likely.
Okay.
Yeah.
Had no word yet.
Yeah, no word yet. No word. I wanted to give him some space on that one. Like, I said, here's your options. This is what I think should happen X, Y, and Z. Because she wants to play basketball, I would say it's higher on the list to get the ACL surgery.
I would say it's probably a good idea.
Yeah.
How old is she?
14.
Oh, yeah, for sure.
Yeah. So I said, hey.
She can grow out of that.
Yeah. If you want to be playing at a higher level in the college levels, like, let's highly consider it.
Yeah.
For me, I'm not playing any pro sports. So.
But I mean, she'll
Yeah.
when you're 14, the rebound is so
fast.
I mean, the rehab should be clean. We have some tricks and things we do here
Yeah.
that'll be wonderful. Explore some PRP options or something like that.
Yeah.
I think it's a great idea just to cover all the bases. That's interesting. A poor thing. That sucks.
Yeah,
That
so
just sucks.
that one it felt like a little bit of a downer, but in some ways I was grateful to have experienced my own torn ACL, so I knew exactly what she was feeling.
Like we said, we know you because we are you.
Yep.
We are you because we know you. We know you because we are you. Yeah, that's it.
Yeah, I remember telling her like in the office, I'm like, hey, next day it's gonna suck.
Yeah. Oh. That's the funniest thing I think the players have ever taught me or told me was I say, how's it feel when you go to bed? They say, usually we're fine. Now there's some pain meds involved, things like that. So they're crashing out. I go, how's the next morning? They said, it's that quick check. They go, I start to get out of bed. Okay, I'm okay.
Yep.
Sit up. Well, that kind of hurts a little bit. Turn around. It doesn't feel too good. And then, everything else kind of cascades from there. So
Puts the foot down on the ground.
Like, oh, that sucks. Okay.
Yep. Yeah. So that was my week, but yeah, we're hopeful for her because we caught it early and we know what to do at this point.
Yeah. And she's, if you're that high of a level, you're driven enough. And as long as her mind, because everybody tells me the ACL, I've luckily, knock on wood, never had one. Yeah. But, never torn it. But it's the mental component, getting through that rehab. Because it is not, but the surgery is not the biggest deal. The rehab can be brutal.
Yeah. Just because of the different
ACLs
options
are
you have
tricky,
to do.
man. Just tricky. So, all right.
No, well.
Any good news? Any uplifting things? Any positive things? Any 9-year-olds you tortured recently?
Yeah. Well, I just technically tortured a 9-year-old out there.
9 or 10, I always forget.
He's 10 at this point. But
he's doing burpee box overs, which is like my favorite torture device.
Oh, yeah. It's fun for him. He's at the age where he's strong, but we can't get him to focus on certain things where I'm like, hey, I want to go over like squat technique, but it's not going to happen with you right now.
No.
So I kind of have to play, but also make sure we get what's needed out of it. So we played with some bounds today. We did the med ball over the shoulder.
Nice.
Just
Love
to get
that
like
one.
extensions.
Yep.
It was funny because I saw him sandbagging a little bit.
Yeah, of course.
Got the 18. He was like, could you do this when you were my age? I'm like, that doesn't matter. Just go do
it's
it.
Irrelevant.
Just go do it.
You're lucky enough that I know what to do at your age.
Yep.
So, I did. I was telling David or Doc. I was telling him on the ride home. We have just so you guys know when we say the ride home, which will probably be the way to start all these conversations coming soon. It's about an hour and a half, 2 hour drive back because traffic is horrendous. Those out there from the area know 405 around 4 or 5 o'clock in the afternoon is not the place you want to be ever, especially driving. But I was telling him I just did a workout with my kids and I did the med ball over the shoulder, which is a torturous way to teach you how to squat better and then extend the hips to get the ball over. Because you'll even a 9 or 10-year-old is going to realize real quick, if I pop the hips, it's easier.
Yep.
Yes. It's that next one. So here's my favorite workout, truly, is that burpees and box jumps.
Yeah.
You put those 3 together.
Yeah.
Because now it's like similar hip extension mechanisms, but different planes. And it is horrible. Love it. They start sweating.
Yeah.
Oh, you're like, yeah.
He physically said, "Can I grab some water?" Which he normally does. I'm like, oh, we're doing something right here.
My daughter has that bad habit. She's like, I need to get a sip of water. I'm like, we just started. You're 30 seconds in. You don't need water. You're fine. You're hydrated enough. I promise.
Yeah.
God bless her little butt. Okay. Oh, cool. All right. Anything else?
Those are the biggest things right now. Yeah. A bunch of the athletes that I was working with over the summer are going back to school. So so we get the transition. So I get their parents, which is kind of fun.
You fix them now. They're broken. The kids are gone.
Yep.
That's funny how it works. Well, let's see. I've got, not a lot. I mean, it's been a normal week. The patient that just left before we started the podcast, she's a frequenter of SHARC in general, the clinic itself, but she's a avid runner. Loves herself a 6-7 mile run daily,
which I don't know how.
Very petite. And she said the magic words, which I started laughing. She goes, I said, look, it's a patient we've been in the clinic for a long time. Great relationship. She just loves running. I kept telling her, we got to get you a little stronger. Doesn't have to be bigger, just stronger, right?
2 different things.
So you can absorb the running. That was it. And of course, the first response, a petite female runner says,
I don't want to get too big. Yep.
And I just started laughing. And of course, I go, do you see my frame? I am just, if you're listening, not hearing, I'm 6 foot tall. I'm 200 pounds. Okay. I'm not a fat guy, but I'm not, ripped, but I'm a 200 pound guy. It took a lot of work for 20 plus years to get to the strength that I'm at now. And to her, I'm like, she is so petite and she runs so much. She'll never put on muscle. It is literally impossible. She can strengthen what she has.
Yeah.
Maybe holiday weight will add a pound or 2. But I'm like, sweetheart, there's literally no way. It's physically impossible. You and I, no problem. We'll eat a ton, lift a lot of heavy stuff, and won't run. We won't even quickly walk a flight of stairs.
I'll sprint. That's it.
Yeah, I'll sprint very short period of time.
Yep.
I actually did do a run.
Okay, yeah.
So back check in. I've left out, been good.
Mm-hmm.
I actually did the med ball over the shoulder.
Okay.
40-pound ball. And then 15-yard shuttle runs.
Okay.
8 in a minute.
Okay.
Plus push-ups and ring rows. And I didn't have any pain the next day. Now, the worst part is I'm starting to attribute some of this maybe to my car.
That was a fun discussion.
But this morning, because I slept, because I'd flown in late and got up early and slept horribly, the day I felt fine. So I think it was just I was exhausted.
Yeah,
and I haven't slept the rest of the body yet. Season kicking in. I get to trading my Tesla. They're buying it back from a Lemon Law. Very excited about that because I'm just tired of taking it to the shop. It's on its 4th battery. Got a new one because I still love Tesla. It's still a great car. But I have to get tomorrow a rental car. Friday, drop the Tesla. Friday afternoon, get on a plane. Saturday night, get home. Sunday morning, drop the rental car off in the morning to catch an 8 o'clock flight. Back out of here. That's my Thursday, Friday, Saturday.
Yep.
Yeah.
It's super busy.
And then order a car online, which is still the trippiest thing to me ever. The first time I did it was trippy. Now it's even more. I'm like, God, it's just so weird.
Yeah.
Delivered. Anyway, that's my week. I mean, she actually, back to the patient. She's actually verbally committed to changing, like fixing some of these things.
Okay.
And I'm going to let this topic bleed into our main topic.
Yeah.
But basically, and it was interesting because I kind of thought of this off a whim. Most of the things I come up with, I don't plan the thought. It just kind of happens, and these guys help try to figure it out.
I try fixing it.
What are you talking about? But I was telling her, I said, you have to understand, and you're just like me. Our habit, maybe not 4:30 in the morning, but our habit is to get to the gym. So my habit at 4:35 is to get up and go to the gym.
Yeah, we're opposites. I'm like 4:30 afternoon.
4:30 a.m. or p.m. 12-hour swing.
Yep.
But it's funny because some mornings, like this morning, I had to remind myself, no, you're not going to the gym. You're going to the office. You have a 7 o'clock patient. I was like, oh, that's right. But my habit is that's my first thought, right?
Go do that. Yeah.
For you, when you're planning your day in your mind, there is a 4:30 to 6 window that you have to get to the gym. And then sometimes like, oh, shoot, I got to do a class tonight, a workshop, or I got to do this. So, I can't do that today. I'll do something else, or time it around.
Yeah.
But as I'm saying this, I'm like, oh my Lord, this is what this is. It's the habit of.
Yeah.
Her habit is to go run 6-7 miles. That's it. To go to the gym and lift weights is not really a habit.
Yet. Yeah.
She'll do a class, and she mentioned the class is great. I love the class. It's a strength class. I'm like, okay, how many reps do you? She goes, 15 to 20. I'm like, that's not strength.
It's like,
That's cardio. And she go, you need to do 6-8 reps. And she go, why do those? I'm like, no. 6 to 8, and you got nothing left in the tank. You got to take a rest.
Maybe I have 1 or 2 left.
Oh, I'm like, yes, different things. So I explained to her, I said, we have to basically give you a new habit in which you designate 1 or 2, maybe 3, but 1 or 2 days where we lift some weights. I promise you run so much, you might gain muscle, but it won't be visible.
Yeah.
Your skirts will still fit, pants, clothes, whatever.
Yeah.
But I thought about that. That's a really good way. I thought, like I patted myself on the back. I'm like, that's what it is. It's the habit of.
Yeah.
Just like drinking too much or smoking or fast food or whatever. You've created this normal habit.
Yeah.
Well, you and I have a good habit with this. My kids are developing that habit. They hate it.
Yep.
I love it. But that was interesting. So with her, we're going to change this habit. And also remembering that you have to get worked on. And this is where we kind of link into a topic. So the topic that Dr. David told me was hot on the internet, apparently. There's been a debate. Oh, you tell me what it is and we'll talk about it.
So I was scrolling through kind of everything on what I see on my car pages and what my friends are talking about and everything like that. But I didn't know if it was quote unquote appropriate to talk about first within our audiences here because it was really the discussions between chiros, PTs, massage therapists, X, Y, and Z. So basically all on the clinic side, it's like, is manual therapy good or not versus exercise? So it was, instead of using them together, it was pitting them against each other. Like just manual therapy, just exercise. Yeah. Which one's good? Which one's bad? Which one's evil? Which one's not evil? That was the big thing.
Which is real? Which is that? Which is this?
Which, personally speaking, I didn't love how it was framed, mainly because it's very clickbaity and we're not using the correct information or context to why or why not.
Well, that won't get you a click.
It won't.
If you got context, am I out of the microphone? I am okay.
No, you're okay. I can still hear you.
If you got that thing, so this is something I complained about months ago.
Yeah.
Is that clickbait thing where you're going, look, they're just trying to, like people out there, unfortunately, like we're like $500,000 in brain power and all the stuff we've learned over the years. which just means that we understand some of the stuff we read. We can source through it like, okay, that's garbage, that's real. And it's predicated on this, or that's this and that, or out of context, it sounds this way, in context sounds that way, whatever. And I always laugh. The one question I go back to, like this patient, this is why I said it bleeds right into it. She abuses her body by running 6 to 7 miles, doesn't have strength, and she just beats tissue up, right? If I just give her more exercise and never treat the tissue, she's not going to heal.
No.
It's impossible.
Yeah.
And so it kind of gets in this like idea of like, okay, well, how are they, first of all, how are they separate? They got to go together. If you have scar tissue, sore muscles, damaged tissue, pick something, you're going to alter the way you move. So if I just give you exercises to fix the way you move and you're moving poorly, now I'm just making you move more poorly?
That's a big question.
Poorlier?
Yep, that's a big question.
Until you're the poorliest mover?
I understand. We're just going to keep going.
Well, play devil's advocate where the way I look at it is whenever I see new things, new devices, new toys, new whatever for the clinic setting, my first thought is, what does this do that we can't do another way, right? So we do ART, active release techniques. We're a soft tissue based place with movement to correct the movement patterns. And that's real simple, makes sense, seems to work. If you're going to say, oh, just do soft tissue or manual therapy, don't worry about the movement or exercise or rehab. Well, I'm like, then you're not correcting the behavior.
Yeah, you're not correcting the habit that we were kind of talking about earlier.
Exactly.
And that's where we get some of the problems. Like when you come to the office, you're at most probably seeing us for an hour. We're probably not doing ART for an hour either.
Oh, God, no.
So,
that would be, that's a massage. No.
Yeah, that's a massage, right? We don't do that.
We don't do that.
So we'll just say it's like 15 minutes of soft tissue, 15 to 20. Now you have to live 7 days with yourself and how you do everything in life. Yeah. So we didn't really fix anything. We made you feel good and fixed a couple things in like a 15-minute period, but you still have those habits in there.
Yeah, and just so we break it down habit-wise, because compensation, habit, it's kind of the same thing. Just compensation pattern sounds really professional, and habit sounds like it's a
sounds boring
drug rehab clinic.
I don't know. We have to be clickbaity sometimes.
I don't. Yeah, whatever. Anyway, but when you think of the habit, you're right. Like, there's a habit of getting out of a chair or sitting in your chair a certain way. That habit over months and years causes bad squatting, bad deadlifting, because you lean over and you're just all these little things. So I guess the comment on this, like I would have to hear the argument about why you wouldn't do soft tissue or manual therapy. Have you heard that argument?
Yeah, I think they were looking at some of the research papers, and I understand what they were trying to say with some of the research papers. That they basically said that exercise versus manual therapy, that there isn't one necessarily that is better or more effective than another. So just pick exercise because it's easier for the patient to get into rather than soft tissue because it's uncomfortable for them.
You know what else I'll say?
Yep.
I get this question all the time. Doc T, why don't more people do what you do? And I kind of smile. I said, it's time intensive.
Yep.
I can't make millions doing what we do because I have to spend time with you. And even the exercise part, what percentage of clients come in here that have seen, pick another practitioner, another genre, niche, whatever, and everything you're seeing them do, they're actually doing it incorrectly.
A ton.
Now, it may not be the clinician. Maybe the clinician gave them the exercise proper and the person misunderstood it, and they get to us, so it's kind of that phone game. But I feel like most patients, by the second time we see them, we've honed that in so they quite get it. They quite get it. They get it quite well.
Yeah.
So I'm like, okay, maybe 50% of those is user error, coming across. But the exercise part in the studies, the thing that kills me is studies. I'm going to be all over the place. I don't care. There was a study on, I remember the book that said, don't ice. Icing's going to kill you. Icing's horrible for recovery, this, that, and the other.
Yeah, I forgot what. It was like a 19.
There was one study.
Yep.
And you know what the study actually said?
What was that?
Drives me nuts. Compression and icing is more beneficial than compression, and compression is more beneficial than ice. That's it. And they used it in the context of recovery. If you sprain your ankle and it starts bruising, ice that sucker.
Yeah, I can understand
quickly, because you need to mitigate that response because you're going to have to identify what's going on. So you have swelling in your knee, swelling in your ankle, wherever. You can't really image that and see anything.
Yeah.
That's why with ACL, rarely do you get in within hours.
Yeah.
Usually it's days. Let's get the swelling out. Let's get everything to calm down so we can see what's going on. So in this context, I'm like, well, okay, exercise is weird. Like we love our happy place is 15, 20 minutes soft tissue work, free up everything, clear up everything, make sure it can move well. Exercise.
And then just to even clarify the exercise, it's not just, hey, here's a list of exercises, go do them.
Go back squat, then row, and then do some burpees.
Yeah, like those first, like in those 45 minutes that we have, maybe those first 15 is just teaching you what we expect out of it. Like, what are we looking for? What are we trying to accomplish? Yeah, rather than like, if you were to ask me, like, give me like 5 exercises to do at home, like, these could be right answers, but if I don't show you how to do them correctly, it's like giving you a recipe without any instructions. Yeah. You could end up with a cake.
Here's your 5 ingredients. You guess how much.
You could end up with a cake. You could also end up with cupcakes or pancakes. So if you don't have any instructions.
Or I'm not going to tell you how much of each thing to put in.
Yeah.
How many scoops, how many teaspoons, how many tablespoons, how many cups. Like, nope, you figure it out.
Nope.
That's what it is. Mm-hmm. So when you told me this, I started laughing because I was like going through my head going, I think I would have to have really listened to some of the arguments, but I imagine it's mostly around selling product. Kind of like or pushing some agenda or idea as opposed to in the context of the patient. Yeah. Because I mean, you're 3 years in now? God,
yeah, 3.
Getting old, man.
I know.
And it's like you look at patients when they come in and the one I just saw, they can't move. Mm-hmm. So if I give you rehab and you hurt your low back, say, or your knee even, knee, low back, whatever, and I give you rehab right off the bat, what movement patterns are you going to use?
For the knee?
Inhibitory ones or like functional ones? It's going to be inhibitory. Yeah. You're trying to unload the tissue. Like when you sprain your ankle, you limp to unload the tissue that's damaged. Yeah. It's very simple. So that's the point. Well, if I give you exercise too soon, because it's only crux, right? When they have somebody hot low back, it's like I got to be careful what I give them because they're going to avoid that back like the plague. Like the one mutual patient we had.
Oh, yeah, that one.
Couldn't touch his toes, right? I told him to bend over and he looked like I just shot his dog. Yeah. He was like, I don't want to. I'm like, just go slow, right? But it's one of these things where it's like if I were to give him, the knees over toe guy or low back guy or whatever guy, whatever guy's doing whatever, and give him these things and he is scared to edit this out shitless, then what is the point? So you have to back it down to what his comfort level is, both physically and psychologically. But the soft tissue piece actually corrected the movement for him. Yeah. So it's like when more comfortable for him to do. Don't do manual therapy. I'm like, but if I do and they can move better, why wouldn't I do that? Yeah. That makes no sense. Mm-hmm. And then the exercise would follow thereafter.
Yeah. Yeah, no, I agree with you on that one. I think when we're talking about like that, those posts or those types of ideas, really the context that they're missing is like if you're just doing one versus another, then we might be missing a couple pieces here.
I'd say so.
Yeah. Like there's nothing wrong with giving someone a couple of exercises to do to fix certain things, and I think that's a great idea to do, right? But
totally.
If the patient's body isn't allowing them to like go touch their toes because it's scared to go move, sometimes that's when we go in with the soft tissue. Hey, allow your body to go do this. Now we go fix some of the problems.
Or scale it down, have them do a seated toe touch.
Yeah, and then if it's
standing, it's just there's so many things you can do.
There's so many variables, and then if it's just the exercises, right? If I just give you more exercises and we've just increased the load that you do on top of everything that you do, we're just gonna get to the point where technically it's a little too much for you at this point, and you just hurt yourself, right? Yeah. So that it won't quote unquote work. So the question or the thing that we're addressing isn't necessarily exercise, it's really more programming. Like, what does your program look like at that point?
It's funny how there's a lot of patients I'll ask them, where are you getting programming from? And they said, the internet, ChatGPT, or myself. I'm just making it up as I go. Mm-hmm. And I said, cool, did you assess yourself? And they're like, no. I'm like, well, then how do you know what you...
what are you missing?
So, the bro science out there is great, but that's, yes, there's a lot of things that are missed.
I will say sometimes you'll stumble across the right things. I'm like, cool, go do that.
You get lucky.
There was one of my patients that has done that with a torn hamstring. It's like he kept doing the right things. Yep. Listen to his body. Cool.
Listening to the body's the key too.
That was a big thing that he did. He listened what he could and couldn't do. I'm like, okay, cool,
so
go
important.
do that. But if I'm just going to throw you exercises without any assessments, that's no better than doing anything else, like opening up a book, randomly pointing to a page to an exercise, and
go to page 262 on the left, 3A, 3B. That's you. Okay, I'm gonna learn karate from a book too. Makes total sense.
Cool.
Yeah, have you seen Karate Kid? Yeah, you know that reference.
The good one? Because there's multiple.
The OG was the best.
Yeah, that's the best one.
That one still to say. I think I've used that example many times. We're like, well, I did this, that. I'm like, did Karate Kid learn karate from a book?
No.
No, he had to learn to paint. I was still like, I don't think that would have worked either, but that's funny. I love the concept. Conceptually, it's like a great thought.
Yeah.
So there's to get to the, and then the idea of this, what is the purpose of what you're doing? Like, why am I doing this? Mm-hmm. And I think the explanation, like people ask, why I do soft tissue or why my thumb hurts so much all the time? It's because of this tissue, right? I mean, it's like, what does soft tissue manual therapy do? A myriad of things, right? We're talking blood flow stuff. We're talking scar tissue stuff. We're talking restoring normal biomechanics and range of motion. Like, there's so many pieces that it does that I don't understand. I mean, you, when you're an intern, had other internships in places you went. So you saw, PI clinics and Justin clinics, all kinds of stuff. And you gravitated towards this because it made sense. It wasn't like, I'm going to do this because I want to make money or I want to do this or I want to do that. It's just like, well, it just makes sense.
Yeah, it makes sense for the patient.
You know what I mean? Like they're going to get their... If you do just soft tissue, which I had done in the past, but I was more rehab based, you're going to get better. If you do good exercises, you're going to get better.
Yeah.
If you do both, you're going to get better.
Mm-hmm.
I love saying that.
Better.
I know. It's so bad. More better? No. See, where does it go? Yeah. But you're going to be a better athlete, person, mover, healthier, all that kind of stuff.
Yeah.
And that's the thing I think is this clickbait, and people unfortunately will get out there and say, well, I read this or I read that and I saw this and I saw that. It's like, okay, how did you feel when you did these things? I felt pretty good. Well, how did you feel when you did those things? I felt pretty good. How about you when you did them together? I felt really good. I'm like,
yeah.
Why stop?
Yeah, why are we stopping on that one?
I don't get that.
Yeah, it's almost like the whole discussion between like ice, heat, and all that stuff. Like, is it good? Is it not good? And like, it's funny because a lot of patients will ask me that, like, where do you stand on that one? Right? I usually just take a step back when we're discussing it. Like, are you looking to fix something? Or are you looking to feel better? Because if you're looking to feel better, that might help you do the other stuff that will fix the problems. So go do it, right?
Yeah.
If you're completely, I don't want to do this because it's out of my way. It spends too much time, expensive. I don't care. Don't use it. Right?
I tell them, I go, ice. If you ice and you like it, do ice.
Yeah.
Heat and you like it, that's great. Mm-hmm. Then do that.
Yeah. I have a preference, but I don't care.
And there, the medical side of things, typically when tissue's damaged, ice. When tissue's sore, strained, pulled, heat. It's just blood flow for one. The other one, trying to mitigate some of the detriments of inflammatory processes, or tissue that's damaged. You don't want to just ice it, chill, whatever.
Over swelling, we don't need that right now.
And that's from decades of successful processes. But the one thing with that thing that still bugs me, I'm still going to, is they did everything predicated on recovery. And I was like, well, wait, then aren't you the same people who are proponents of cryo tanks?
Yep. It's the same thing.
For recovery? I'm really confused now. So like, okay, let's not, whatever. Yeah. Anyway, so.
that gets to a fun rabbit hole of stuff that.
Well, that's the hardest thing of our job, I think, is just trying to keep up with all these trends of all these new things. Yeah. And I never want to poo-poo anything or knock anything, but I'm just more practical and like, does it help?
Yeah. And here's the thing, like, ice is available at home, right?
Oh my God, the cryo tank thing was hilarious.
Yeah.
I had patients paying $150 for a 3-minute session.
Yeah. I went to an internship where they had it. I tried it because I'm there.
Well, sure.
Yeah. It was cool, but like.
Did it change? Well, here's the thing that gets me too. Yeah. This is where I'm like a Wim Hof altruistic kind of guy. I'm a supporter of it. It isn't about the cold. It's about the breathing. This is the thing that gets blown away, forgotten, is that when you're doing ice baths, cold plunges, things, and the same thing in context. The context of it all, the purpose of that is breathing control, learning to breathe under duress. This case, cold. That's it.
That's
it's not about just being in a cold tank and freezing your butt off for 3 minutes. That's not the point.
Yeah.
The point is, can you control your breath inside of that? There comes the benefit.
Yeah.
Anyway.
Yeah. But also, like, when we're doing all these manual therapies and exercises, we're taking into account you as a person as well, right? I remember, I think this is where in school I really thought about, like, oh, chiropractic as a profession. There was one story about a patient going into a doctor's office and they were being assessed for like a cancer. I'm not saying that chiropractic for cancer. No, we're not doing that.
We're not treating cancer. No,
we're not.
No.
It was just a medical doctor kind of treating for like oncology thing, right? The patient was having, I forgot what type of cancer. It might have been breast cancer or something along those lines, where he wrote down everything, gave her all the scientific things that you're supposed to do. Like, here's your chemotherapy that you're going to.
Here's the plan.
Here's the plan. Yeah. Did everything right. There was really no change, right? And then she went to a different doctor, went hands-on, kind of palpated, seeing what was actually where the tumor was, where the problem is. She had better results. So sometimes it's, hey, we're having a moment as a doctor and a patient where we're assessing really what's the problem, and we're kind of going from that point, and you're trusting us with your pain. And from that point, you a lot of times just have better outcomes as a patient.
Usually. And the thing when you're doing, here's the other thing kind of got me. I never quite understood about doing one modality versus multiple modalities. When I get my hands on you and I'm feeling hamstrings or quads or glutes or neck muscles or whatever, I can now see what the texture of it feels. Are we talking Slim Jims? Are we talking beef jerky? Like, how does it feel? That tells me the health of the tissue.
Yeah. And I think you mentioned this too, and I really stuck to it as an intern. It was like, the book will say 5 to 10 passages on specific muscle,
the
right?
books.
And then you get to a spot like we've seen at this point. Well, I've seen at this point finally. You get to it, lights everything up.
Yep.
Now, if you're on past 9, do you stop?
And that's so. Yeah. The funny part is when you get 9. Like the biggest thing is funny in here. I tell people we don't chase pain. So you can point to every place on your body that hurts. No. I'm not going to go for it. I'm going to figure out what you're doing to cause the pain. The ironic part. This movement causes pain. So I'm going to help correct that movement so it doesn't cause pain, right? That is where our minds come into play on what tissues we're going to go after, what we're going to fix or treat or whatever.
Yeah.
But 9 times out of 10, you will be working through and you'll find that one spot that you just see their eyes pop out and the emoji face is created.
Yep.
And you're like, okay, there's something here with this tissue that's causing something. And so if you don't ever touch them and you just give them exercises, the theory, even the concept of like, oh, that's just going to correct that inflamed tissue or scarred tissue or whatever you want to call it, dehydrated, who knows? That is never going to happen. It's just never going to happen because the tissue can't function. And when you have scar tissue, this thing about the science part I love. I would love to hear where they get their studies from. But scar tissue or adhesions, whatever word you want to use out there, basically these knots there in your muscles, they have been shown neurologically to become landing spots or origin insertions like a bony anomaly within the connective tissue. That's going to affect how the nervous system perceives that muscle and its job, what it does, what it's supposed to do, or what it isn't doing. And I always tell people when you get scar tissue in muscles in certain places, you're taking a muscle that has 100% of job A and B to do. Now they've only got 95% functionality to do 100% of the job. Well, that's a snowball down the hill. Now you're just waiting for the next kind of shoe to drop. Like you don't have an ACL. So your muscles have to do two jobs.
Twice as much work.
We got to stabilize and we got to move.
Yep.
And that's why a bad aberrant movement or fall or landing, little twist, little tweak, little off, the hamstrings can't stabilize and absorb.
And especially if I've never trained in that position. There's so many things.
It's one of those things that you gotta, it just gives you, and this is the other thing too, it gives you information.
Yeah.
Like we pride ourselves in spending time with patients, actually listen to them talk to get information. And yes, you are way better than I am. I'm a salty old guy, but that's the purpose because they're going to say something. You're like, never mind, got it. And you'll find like if you don't listen and don't really kind of navigate the waters of their brain, because they're going to tell you what they think you need to know. They're going to tell you what they think it is, of course. And then you have to take all that information plus your clinical and then figure it out for them.
Yeah.
Well, part of our hands-on process is that diagnostic feeling. Like, what do I feel in there?
And a lot of the times when we do manual therapy, sometimes it becomes like halfway diagnostic too.
Oh, 100%. 100%. ART actually prides himself on that concept because you can tell the health of the tissue.
Yeah. It was kind of funny because there's been a couple times like, you know, a lot of times when we're dealing with like a low back thing where the problem isn't really like a low back, but it's their inability to actually get into a hip hinge.
Yeah.
We'll treat everything around the hip. And they're like, why are you treating that? Just like, just trust me.
Yeah.
Hear me out.
Yes.
And then all of a sudden you hit one muscle and they're like, oh yeah, I remember when I do X, Y, and Z, I can't, this is what happens. Like sometimes that's why we use manual therapies to get some of those answers out too.
Yeah. And you just, it's information. I mean, it's just the more you touch and feel and move.
Yep.
Like my favorite thing now is I have a patient, tennis player. She came in and she goes, my left hip is bipolar. I was like, please explain. Like, I just want to hear this. Yeah. And she goes, I'll do 20 reps of like a hip hinge motion, one of the movements, whatever. Half of them I can feel my hip actually doing the job, and the other half I don't feel anything. And I kind of laughed. I said, yeah, your body's just neurologically structuring itself to move in a bad pattern. Habit. I love the way that sounds. Now we're trying to give you a new habit. And every week or a few days, because she's a good athlete, she'll get 11 good reps, 9 bad. 12, 8. And eventually she'll just get to where she just feels it working. And she goes, why does that happen? I go, sitting, driving, moving, any number of...
The body likes
unless
taking
they
shortcuts.
followed you around since you're a baby. I have no idea, right? Like my daughter walks on her toes. She's going to have calf issues.
Probably. Yeah.
I guarantee it. Yeah. By the way, shuttle sprints on the last one, because she went last one, oldest to youngest. Mostly because I didn't want them watching me die on the last one. So like that way it could be done. When I said, I'm going to run them with you, but don't let me beat you. She beat me. I tried. And I was like, no, I'm not a runner. I'm not a sprinter. And I'm just getting back to moving. So I was exhausted. But dude, I was like...
they're also swimmers. So.
Sandbagger. Oh my God. So anyway. So yes. And you look at connective tissue as well. Like the number one predictor of injury is a re-injury. Like number one cause really. Because the initial one was never really fully fixed.
Yeah.
Right?
Wasn't addressed.
If that's the case, how would you have identified that by just doing exercise?
Some people say that they can. Cool.
No. You can't.
I'll let you say that.
How many people have you seen squat and they look like a beautiful squat? But then when you try to throw a little like a weight on them or a soft set or do a single leg and they fall apart.
I've seen a lot of that, especially with my powerlifters. I hate saying it. I'm sorry, guys.
It is. Yeah. So there's no way There's no way.
It's like you guys are strong in one motion because you've trained that motion, right? Now we
over and over and over.
Now we have to make your habits throughout everyday life. When you have to exist for the next 23 hours,
Yes.
we need those clean.
It's like when people
as
say
best
I
we
stretched
can.
once today. I'm like, and then what'd you do the other 23 hours every day?
Yep.
24, three
It's like,
and a half.
you still have to hang out with yourself for
Still
23
more,
hours.
man. There's more. Do more.
Yep.
Yeah, and it's funny because I made notes about all the stuff that we do with soft tissue because I was just thinking about like, what do we like? This is stuff we just inherently know, and then I started looking and going, oh my god, you're like, yeah, there's recovery and mitigating injury risk and enhancing performance and improving the quality of tissue and range of motion. I was like, oh my god, there's a lot of stuff that really goes with what we do with that too.
Yeah, and it's not that we're just talking out of our butts. Well, I might have to edit that one out, but we're not just.
Well, that'd be disgusting, but yes,
we're not talking like that. But it's we also work with professional athletes. So once you've done it for like 9 years, I'm just starting like.
I've done it for 20, but yes, 9 for the Chargers.
Yeah,
yes,
for
yes,
the Chargers.
For the one team.
That's
yes.
what I was trying to say.
Yes, for the one.
But 20 years for higher level athletes too.
Yes.
Not to take any credit away from you.
Come on, bro.
Want to make sure you get everything here. Yeah, they train for what? 3-4 hours at a time. They're also getting recovery for 3-4 hours at a time.
And you see some kids that are good.
Yeah.
They get it, man. They're on the table. They're getting their stuff done.
Yeah.
And I will say this also. I know this from just experience. It's because you can't do a study or test this thing I'm about to say. It's just kind of do the experience of. You've now experienced this with pulling a 150-pound leg, and the hip doesn't gap, right?
Yeah.
The problem is with the connective tissue piece, right? If I work on the connective tissue, so soft tissue therapy, manual therapy, around the hip area, and I take all the muscles that compress the hip and I get them to let go. When I go to distract that hip, it moves really nicely. And I've actually done the experiment where I tried to distract it first and then didn't go. Did all the connective tissue mobility stuff.
Did it again.
Then it goes. Right? So it's like, I can understand. You may just be hardlining saying, no, it didn't do that. It just, I don't know, the moon shifted. And to me, I'm like, well, no, because I've also done the version where I couldn't get it to move, had them do exercises, still couldn't get it to move. It's just one of those things that connective tissue and soft tissue has a role.
Yeah.
Has to be addressed.
Yeah, it can't. I don't think it's ever going to be fully thrown out, right?
No, it shouldn't. Well, I agree. I think the clickbait part of it all is just, I wanted to talk about this because I want people out there to actually hear what I think is a very common sense, pragmatic approach to the process and why. And I'm not saying they're wrong. I'm just simply saying we're right.
Yeah.
That's all I'm saying. And I have the years to back and experience in, but it's one of those things where if you have the athletes and the people you worked on, you've done like, I don't know, have you done that yet? Have you tried let me try this first and see this?
And then go back to it later?
Yeah.
I have.
It's just, it's fun because the patient doesn't care. They're going to feel better no matter what. But you get the input of like, oh, wow, this joint gapped wonderfully by doing this first as opposed to omitting this piece. And let's do exercises instead.
Yeah. And then when you go back to those studies too, I'll say athletes, and it's not that they aren't doing their job as, researchers getting a double blind X, Y, and Z.
They're not doing that.
Yeah,
that's not happening.
It's not happening.
Nobody funds that.
It's more just like, okay, let's talk about that, right? Is it, how long have they trained, right? Are they at the professional level, or
are they paid to play or paying to play?
Or have they only really just been exercising for three months, right? That's another question to ask, because there's a skill level component. Are they good at this? Are they not good at it?
And just the fact that you're going to have somebody working on you, right? And the way to look at this is they're getting paid to play. You're paying to play. If you're paying to play, you probably can't financially afford us in your back pocket 3 days a week, plus massage therapist, plus a nutritionist, plus. So that's kind of the other caveat. And so we talk about weekend warriors. Most of the studies and tests are done on those type. And the other thing out there, just educationally, people out there, when you're reading studies or where they're quoting things from, understand they're not going to spend a bunch of money on a study. That's not going to either cause money in return or develop a product that's going to make money. They're not just donating their money to, I just want to find out if this works or not. It's like, that just aren't really funded.
Yeah. Like we would find a lot of joy in finding some of that, but
be awesome.
No one's going to give us like $500,000 to go figure that out.
They're really hard.
Yeah.
And a lot of the studies that are funded these days, nutrition, exercise, all that stuff is really predicated on giving foundation to their product.
Yeah.
That's all it is. And that's the stuff that drives me bananas, because it doesn't really help you, the patient out there. And people say cryo tanks. I was like, I kind of laugh like, yeah, but unless you're a professional athlete, unless you're running a 4.240 and now you're running a 4.18, that cryo tank helped you monumentally.
Yeah.
How about we just work on your mobility, your stability, your soft tissue, basic exercises.
Yeah.
Let's do that first.
And let's even go like one step farther back, right? Because when we talk about like the isocryotherapy, like
Yes,
the sensory depression tanks, like those ones where you can't hear
Deprivation
anything.
tanks, yeah.
Yeah,
Yep.
those ones. Sensory depression, it's not that.
It
Deprivation.
can be if you don't like
it. It can be. Like, yes, you're spending a lot of money for that, but that's what I call like my last 2%, right? That's the icing on the cake. You've done everything else.
Yes.
But did you fix
Kitchen
your
sink.
Yeah. Did you fix your sleep? Did you fix your nutrition? Did you fix your training? Are you
Breathing
training appropriately?
patterns.
Your breathing patterns? Like,
Yes.
do you fix all of that? That's more like your 80 to 90%. Like that's that. And that's where we focus on in terms of rehab, in terms of like manual therapy. That's what we're focusing on. Because at least in my visits, like when I see someone get injured like for the first time in a while, I said, hey, was this a stressful week for you? And they'll say, yeah, it was finals and I tried working out harder than I needed to because I felt like I needed to get a little bit more. I'm like, you threw out your back after that? It's like, yep. Did you get sick right after? Yep. You redlined and you kept going.
Yeah.
And that's kind of what happened.
Yeah. And most of our clients, and this is just speaking to our clinic and our clients, basically, they are wired that way.
Yeah.
We're wired that way. So that's what's going to happen. And so like with the habit, like my gym habit is not always a great habit.
Yeah.
So we had a patient today, he joined a new gym.
Yeah.
I don't know if you know about this local, I'll tell you about it after the air. But apparently they have belt squat machines.
Ooh, fun.
They have sleds. He walked in, he goes, I felt like a kid. And we talked about the gym for 15 minutes because
That's awesome.
that's what we are.
Yeah.
If I could have my practice, like my table inside of a gym again, sure. Like we practically have one here, but I'm like, I love it. I love looking out and see all the equipment. But he never going back and forth, dying laughing because all these things. And I go, did you have to make yourself leave? He said, the parking is 2 hour max. So I have to leave before then I get a ticket. So I said, I set my stopwatch on mine or my alarm to make sure I leave.
Yeah.
Because I'm like, I have not tried that piece of equipment yet. I
So
haven't
you
tried
gotta
that thing yet.
yeah.
It's so much fun.
Yeah.
But again, that's my habit and that's our clients' habits is generally to overdo it. And our remedy for being sad, being down, being tired, being overwhelmed, being stressed, being happy, our habit is to go exercise.
Yeah.
That's it. I feel bad today. I'm going to go squat some shit then. I'm going to go big.
Yep.
Why? Why not?
Yep.
And it's like one of those things like I'll feel better.
Yep.
And probably 6 times out of 10, we feel better.
Yeah. There's that deadly 4 though. Sometimes what happens.
And it's almost like a quarterly thing. Like,
Yeah.
I don't know how we got deviated from that topic.
It was just like the foundations of everything, right?
Yes.
You know, like, yes, exercise is really a foundation of stuff when we start talking about everything, but it doesn't mean we just throw
I
more
like to
at
say
it.
better movement.
Yeah.
Like exercise can be anything. Movement, like really the foundation of how you're supposed to move, so to speak, and making sure that's implemented is vitally important.
Yeah,
I agree.
absolutely.
But I would love to ask those guys, when's the last time you had a conversation with somebody who stood up out of a chair and you watched them sit and stand a couple times and taught them how to do that properly? It's like they don't cover that. People just generally don't go, oh, what about this? How do you get out of a car? How do you get off the sofa?
It's not that those emotions are deadly, but
No.
it's more of like, okay, if you're having back pain doing that, let's see
They
what's
build
going
a
on.
habit of movement, so that's just how you move.
Yeah.
That's it.
So where would you stand on this, Dottie?
Oh, boy.
I know a lot of people are already trying to figure out what our stance is. I think we've kind of talked about
Like I
it.
said, I'm not saying they're wrong.
Yep.
I'm just saying we're right.
Yeah.
That's it. You have to address connective tissue, soft tissue. You just have to.
Yeah.
I don't believe there's I believe there are practices out there, not just practice like medical or whatever, just practices like you practice personal training, massage therapy, whatever it is. And you really are a big fan of the movement part. But everything I've learned in 20 plus years with all the credentials I've gone to, every single one has a soft tissue component.
Yeah. Of some sort.
And it's like you can't study test that. It's just impossible because there's no context, right? Your tissue today is not going to be the same tomorrow.
No.
Wasn't the same yesterday. Just how it is.
Yeah.
And to give an example, a real quick one, I explain to people, if you really want to know what's going on with the low back when it comes to MRIs, spine, any part of the spine, do it first thing in the morning.
Yeah. Versus
Roll out of
the end
bed.
Yep.
Just drive there real quick and get it done. And they said, why? I said, because most people do it after work. Well, what have you been doing all day? Sitting.
Sitting, standing. whatever.
What's constant? Gravity. So yeah, you're probably, if you have a small bulge, you're going to have a bigger one because end of the day, do it in the morning. And so that's a significant notion on how gravity affects you. So if you have a knee issue, back issue, shoulder issue, whatever it is, you're having to get through those days and those things. That's going to be a connective tissue issue you have to address. Don't care.
Yeah.
The exercises, and if I have somebody who's just does soft tissue, I'd argue, well, if you don't correct the behavior of the nervous system,
They're just gonna
i.e.
come back.
functional movement, something like that, they're just going to go back, which for a business model is great because I'm going to fix it. You're going to feel better. See you in 6 weeks.
Yeah.
Because you're going to do it again or do something else. And I'll just keep on fixing that new recurring problem. That's called reoccurring revenue. You've got to address why. Now, the thing with our clients, I love them out there, everybody, because as much as they do the things we ask them to do, inevitably they stop doing the exercise part. And then they kind of circle back to the getting hurt again and come back in.
Yeah.
And like the runner we had today, I was like, I've seen her a dozen times for the same thing. And I'm like, I love you. Did you please do the exercises?
I know exactly what you're talking
You are
about.
not going to get bigger, I swear to God. I swear to God you won't. And so it's very funny. But yeah, so I stand firmly on you have to do both. That's why I started my practice the way I did 20 plus years ago. That's why I've done what I do today. That's why you're here. That's why people come here. It's because you address both sides of the coin. You just have to.
Yeah.
And if you do, they're happier. They're better. They feel better. They move better.
Oh, yeah. So yeah, definitely instead of versus, I think that's the wrong word to have in between manual therapy versus exercise. It's do both, right?
Yeah.
Do both. It's going to come back to the patient. Like if we really talk about what's a successful practice for a patient, it's patient first, right?
Always.
We're doing the best thing for the patient at this point, having them feel better once they leave, but also giving them stuff to make them feel better, right? Afterwards, so they don't re-injure themselves or do other stuff. And if a patient is happy with all that, there's better outcomes.
Always. And the funny thing is like so our protocol roughly is once we get you, you're done, you're good, is yes, we'd like to see you every few weeks, especially if you're going to train and work out the way you do, because you need your soft tissue taken care of. However, what we implore that you do is all the exercises that we gave you through that time, like forever. So we stand firmly on both sides, and we agree with both sides. They're just you're right. They're wrong for putting a versus in between.
Yeah, it's not a
That's
versus.
the wrong way to put it. Yes.
It's
and,
not a versus. It's
not
and.
or, and. Best outcomes you're going to get.
But yeah, that's basically where we sit on that one. I feel like we beat the dead horse on a lot of this stuff here.
No, I like babbling about it because honestly, when you talk to people, and this is something you've learned and will learn more, but when you talk about something and you can talk about it 6 different ways, examples, experiences, somebody for the first 5 minutes was like, I don't quite understand what you guys are talking about. Yeah. And then 10 minutes, I'm like, oh, it's just like, it's a good way to do it. I don't mind it. I know it gets a little long. Yeah. Mostly because he has to do the editing on it. So
well, it was funny. One of our older interns, he texted me, he's like, when's the next episode? So I just sent him over, like, what we just uploaded. He's like, I don't want to watch all of it. I'm like, I don't care. You can watch it.
I'm not editing it. You can figure it out. Yeah. Excuse me. Yeah, it's a process. But it's important for me when I love talking about topics because there are a lot of examples pop in and out from other things, like the cryo tanks. Yeah. So I don't we didn't beat the dead horse. We could. I could go for a while.
I don't think we need to.
No, we're good. We're good. So people out there, it really comes down to this. And if you're going to choose, you're like, I disagree with you guys. I think just this or just that. Cool. I would simply say to you, that. Yeah. But I would say, if you just like soft tissue, if you're in that corner, try some of the rehab with it and just watch how you feel. Watch the difference. If you're just doing exercises, try getting a massage or some soft tissue work done and then see the difference. But don't do one or the other to see. Keep doing what you're doing and add something. Yeah. And then just see. And I promise you, you're going to feel better. Not just different, but better. Yeah. Because it's just what's going to happen.
Yeah. Absolutely. Like if you continue down the road of soft tissue and you're still getting pain, was that the answer? Or if you just continue with exercises and you're still getting pain, was that the answer, right? Yeah. Why not do both, right?
It's like the stretching thing. Just stretch. I'm like, no, don't stretch.
Good.
I mean, stay mobile, move, but don't just, my back hurts, so I stretch. I'm like, well, what did you stretch? Yeah. And I go, stretch everything. How'd it feel? Well, it felt good for a little bit. I'm like, then, okay.
And then it came back?
Yeah. Again, like 30 minutes later, I'm like, that wasn't the problem.
Yeah, not the problem.
Not the problem.
Let's do something else.
So, okay. I'm good.
Yeah, I think we covered everything that we need to. If you have any questions about this, go ahead and message us about it, DM us, put it in the comments.
Please, and if you want to know more, understand better, or get better explanations or whatever, just, let us know.
Let us know. You could hop into a discovery visit where we can beat more of the dead horse on this.
Well, actually, it's funny is when you think about that, the reason we do that is because they really, who was it? We had a marketing group that we used. And they kept trying to give me this 30-second elevator pitch. And I was like, for what? The knee, the shoulder, the ankle, the nose, the head, headaches, migraines, torn knee, like for what? Yeah. They're all different. And until I see you, I have no idea what I'm going to do. You may come in with knee pain, but I find out you have a dysfunctional hip. Or you have a labral tear in your hip, which I've seen that too. Like I won't know that unless I see you. So the whole point of a discovery visit, and the visit with us, is so we can actually see you and take your body and move it to see how it moves.
Yep. And tailor everything toward you.
That's the only way to do it.
Yeah. I feel that's everything here.
We'll see you guys next time. I'm Doc T.
I'm Dr. David.
All right, guys.
See you.